Let's go straight to Jeremy Hunt, who is, of course, the chair of the Health Select Committee in the House of Commons. We seem to have a move to delay, which is the next phase of the dealings that the government's got with coronavirus. Mr. Hunt, very good afternoon to you.
Afternoon, Mike.
Thanks very much indeed for joining us. It seems as though there's a slight shall we say, not disagreement, but a slight sort of uncertainty about whether we've moved to delay. The Prime Minister's spokesman saying that we're still in contain. Are we definitely in delay now?
Well, that was the impression we got from listening to the Chief Medical Officer this morning. He said there are significant elements of what we're doing now that really are the delay phase, and there wouldn't be a definitive moment. I think in practice, we are now doing all the things that you need to do in that second phase, which is very, very important because, what that does is it buys you time, which means that the NHS can get a little bit less pressured. It means that you can learn more about the disease, which we're doing every single day. But most importantly, the final phase, if it really took hold in the population and we got the kind of 20% of the population getting it like they have in Hubei province in China, that has very serious social and economic consequences. And we need to be preparing for those now because, we cannot rule out it happening.
No, indeed. 3 new coronavirus cases confirmed in Scotland today, taking the total to 90. Is there any ideas as to whether or not the infection is sort of growing in exponentially, whether more people are being infected sort of on a daily basis?
Well, what Chris Whitty, the Chief Medical Officer, said is that we are now getting what he calls community transmission. That means people who haven't been to Italy, haven't been to China, who are getting the virus from someone else in the UK, and it's not necessarily possible to trace how they got the virus. And that's why he said that he felt that we were broadly beginning to move into that delay phase.
Right.
But I think it's important to say that, the NHS is one of the best prepared healthcare systems in the world for dealing with these pandemics. It will put us under enormous pressure if it happens. But the NHS is very good at dealing with these kinds of situations.
Right. And are you discussing the closure of schools kind of long-term, as they have done in Italy, as they have done in Japan, and the stopping of large gatherings? There seems to be a little bit of uncertainty around the large gatherings as well.
Well, that was one of the most interesting things that came out of the Select Committee hearing because, Chris Whitty said there is an active discussion going on in government. I think that's code for ministers have not yet made up their minds on schools. And the reason is because the virus doesn't seem to affect children too badly, but it does appear that they can get it and spread it. So that might be a reason for closing schools. On the other hand, as soon as you close schools, mums and dads can't go to work because they have childcare duties. Yeah. And some of those mums and dads will be frontline NHS workers, doctors and nurses who we absolutely need to go to work. And that's why it's a very difficult call as to whether you go down the route that Japan and Italy have done.
Right. And are you confident, as some are, that in China they seem to be sort of coming out of the other side of it as far as the worst case scenarios go?
That's what everyone believes, and I think that's very helpful for us because it tells us how long it takes for the virus to peak, what proportion of the population are likely to get it at worst, because it obviously has been at its worst in China. So, I suppose that's the encouraging sign. But, I suppose if you wanted to be a bit more pessimistic, it's now taken hold in many countries that are much nearer to us than China. And although we have one of the lower rates amongst European countries, we are surrounded by countries that have much higher rates. Yeah. And so that makes the inevitability of community transmission in the UK much higher.
And I know you've got to run, so I'll just ask you one final question. Are you considering a ban on travel at any point?
Well, I'm not the government, so this is something for ministers to consider. And I think all I can say is when I was health secretary and we had the Ebola crisis, what we found is that travel bans are very unlikely to be affected because there are so many different ways. You can ban direct flights from northern Italy, but people can still get here through a different route. And so my experience was that people tend not to recommend these as the first thing you do.
Okay. Jeremy Hunt, thank you very much indeed.